Hello, Dr. Sabina. Welcome with us today. Can you give us a brief about yourself and your business?
Yes, I'm Sabina. Well, I'm currently a high school teacher, but formerly a cardiac surgeon, and also on the side, I'm also a volleyball coach as well.
Great. Okay, so you have enough knowledge about cardiac surgery?
Maybe a little bit.
Okay. Question number one, what is cardiac surgery?
Cardiac surgery is the procedure when the cardiac disease cannot be treated with the medicines. Sometimes maybe your vessel blockage or you have a heart failure. So that's we try to not to go that route because of course it's a risk. But cardiac surgery only open hearts. There are that technique right now, so you only have a very little hole to go in and do the surgery right now. But for a lot of people, they put the heart on the chest and all right here. But that's all included in the cardiac surgery.
Yeah. Okay, next question. What is the job of the great vessels?
Oh, the job of great vessels? You are looking at those five pumping out in the hearts. You have upper body, and you have we call it superior vena cave that goes into the heart on the right atrium, and we also have an inferior from the lower body side and go into the right atrium, and then go to the right ventricle, and then you will go into the vessel goes into the lung, and then you will get oxygenated, and then coming back to the left atrium, and then go to the left ventricle and go. So in total, we have about 5 great vessels, mainly go pump in and out the blood. I would say transfer and just make to carry out those oxygens into your body. And then we go into the capillary and all that.
Yeah.
That's all 5 of them, yes.
Okay, very interesting. Okay.
Just anatomy, that's, we spent 1.5 years on this. I hope I did not say anything wrong.
Okay. Why wasn't it accepted to operate on the heart before 1896?
It's not just like not accepted. I think it's mainly because people are scared, because when you open heart at a time, they don't have a technique to stop a heart. Like a lot of the times when we do the pacemaker or something, we can stop a heart for a little bit. But I think before I would say 1900, I don't think they have that technique to do that. And also for the religions of a point of view, if you do any blood, that's kind of not that good. But thank goodness this person just take a chance to do the first surgery. It's a very small surgery, like just sewing up the wood. But I think that opened up people's mind and think, oh, maybe human will do that. So I don't really think that's not something not acceptable. It just people are scared. Even with me starting with this job, I was scared because they are pumping really big, and then you have a knife and you are like, oh wow, where should I go, right? So I think with people about 150 years ago, I think that's really scary for them as well.
Okay, that's really, really interesting. Okay.
I mean, have you seen those heart pumping? They are crazy. They are not stopping, and you cannot even hold it because they are actually moving and they are behind the lung. It just you will be so scared to break anything. So,
okay. What implantations? It's very interesting. What implantations can you do or can you use on the heart?
There's a lot. We all know the pacemaker. That's one, and also we have a ventricle device that we will put in under the skin that will help you to pump out a little bit more on the blood. And we also have some of a loop device that can monitor your heartbeats, because sometimes out of a body type of technique is not as accurate. So, and we know right now the sudden cardiac rest is because of fainting. So sometimes we will get into some of those devices coming in to see if it's related to heartbeats. So there are a lot out there right now.
Okay.
Yeah.
What are cardiac pacemakers?
So the pacemakers, you are normally put it underneath, either on the left or right hand side. Then they will generate those pulse, because normally it's for people that their hearts are not working so well. So they will give you the pulse. And now, before when I do it, they have some lead wires. They will go into the chamber in the hearts. Whenever they have a pulse, that's where the muscle will contract. They will push out the blood to the chamber that should go. But right now, I know they have something, the device, you don't need to have any generator right here. You can just put the whole device into your chamber, and then you don't have a lead wire. Those are the same mechanism. Just go to put your heart muscles to contract, and then pump the blood out.
Okay, very good. Okay, next question. Can you cite some examples for first heart transplantations?
Human to human?
Yeah.
I know, because I'm from Stanford. So from Stanford is 1968. That's they brag about it because we are the first one in US, 1968. But I thought the first one in world is in South Africa. It's about probably half a years ago. I would say 1967.
Okay.
But the Asia, even though they have the first case in 1968 too, but in Asia, because we are more conservative, so we did not really started really big until like late 80s. That's what I say. Yeah.
It seems like a very difficult process.
Yes, but again, those are more like if one person do it, everybody go, "Ooh, maybe I can do that." That kind of thing.
Yeah.
So
okay.
It's happening really quick.
You need a trailblazer for every difficult thing like this.
Yes, and somebody has to take the risk.
Yeah. Okay. Next question. What is the cardiopulmonary bypass?
Oh, those are bypass. It's because the plaques. Your vessel was blocked, so you have to create a new pathway to go through those blockage. It can be really big. It can be really small. It's normally what you heard about open heart. But right now, like I said at the very beginning, they are really minimum in invasive way. You're just going under your arm and going into the rib. Your hole is like this small, and then you can put in the bypass like this. So it still depends on where your blockage is. Then we get a new path to go around it. Normally is around this part. Yeah.
Okay. Next question. What is the coronary artery bypass grafting?
Oh, we just lifting it. Oh, that's what I answered the one before.
Okay.
You were talking about the machine then. Okay. Sorry, the one before. That was a machine that will, that's what I said when you have a stop heart surgery. So we connected the arteries on the tube, and then we go into the pump, and so we pump out the blood into the pump, and then we regenerate it and give the oxygen and pump it into the blood, our body. So those are the device that we can like stop the heart beating, and then we have a little bit more time on the heart surgery. I'm so sorry about that.
It's okay. It's okay. It's very interesting.
Flip
okay.
it.
Yeah, like you are talking to a perfect surgeon, so don't worry.
Yeah, I don't really.
Okay.
Sorry about that.
Next question. What is maze surgery?
MACE surgery is normally for the fibrillation, when your heart cannot send out the electronic signal anymore. You know, our heart has to beat and all those with the signal, the ions, the sodiums, the potassium, I know those. Oh no, calcium, right? So when your heart does not have that function, we try to create like a maze, yes, but we try to create a new circulation for your heart to beat again.
Yeah.
So
Okay.
normally for the abnormal heart beating.
Okay.
Yeah.
Next question. What are the risks of heart surgeries?
Pass away, death, and a lot of people did not know after your heart surgery you have a very high risk on pneumonia. So really important ones. And also some of them, even though their hearts are not having a pain anymore, but their back sometimes has a pain. And of course bleeding, and also the complication to the anesthesia. That's happened a lot because a lot of heart disease patient, they probably don't have a good lifestyle, so they responded to anesthesia not that well. Yeah.
Okay.
Sometimes they may paralyzed.
Okay. Next question. What is the role of the cardiac anesthesiologist?
I never really no, I do them a lot. They always told me they are different. I don't yes, okay, they are different because they are normally go with they come with us in the room. They have to meet with the patient before and after the surgery, so they actually have more time with them than us. And they have to go through the very intensive training to monitor, because during the heart surgery, sometimes it will be prolonged. They have to pick the right medicine to make the patient stay asleep, because any little movement will affect the heart. Even if we use a stop heartbeat method, that they are intensively monitoring the pulse and the stability of the patients. They are actually the most important part, I think, in this whole surgery. Yeah.
Okay. Okay, next question. How to manage post-operative pain?
Oh, we have some drugs, and we have to give you some of a blood thinner. Depends on what kind of surgery you have. Normally your healing process was starting at probably 12 hours to 24 hours, and your anesthesia probably will be gone in about like 12 hours. And you have a very intense medications. Some of them probably is the regulational medications you have to take. With the MACE technique patient, we actually will ask them actually standing up to move around it about 1 to 2 days. Otherwise, they will have a really big pain around their chest area. But once they start moving, they can do a little bit better. But not for the other open heart patients. We probably will make them stay in bed for a while. We normally will stay in ICU for 1 or some of them 2 to 3 days. Yeah. So, but depends on what type of operation they have.
Okay. Next question. What is the recovery time?
Depends. Pacemaker, if you're going under the rib, it's probably a couple of weeks. Normally open hearts, 6 weeks to 6 months. But for the open heart, you normally in ICU for 1 day, and then you go into the regular bed probably about 1 week. But for the MACE, they will stay in ICU for 3 days. And then you go into the regular room for, in total, probably about a week. But it all depends on what type. But heart transplant sometimes can go up to 6 months. and that's where you feel a little bit better, and then you go into rehab. So it can be a couple years if you want to fully recovered. But for the pacemaker, I would say about 2 months you should be okay.
Mm-hmm. Okay. Okay, next question. What is the all-in-one hand technique?
That because with me, I'm a very older surgeon. I'm old-fashioned. We normally have a forceps in one hand and so the knife in one hand. So we normally only use our dominant hand. So all in one hand is not just all you only do in one hand. They just have your forceps as something that you can work with your dominant hands. So they have your forehand like have a forceps. You carry like a chopstick. So you can like grab or you open it, and then so that will make you a little bit better movement on the hearts. But I cannot do that because I'm just a very old-fashioned person. But now they are looking at you can use both hands to do the surgery, try to reduce the time. I think that's one of the techniques that they are trying to introduce.
Yeah. Okay. Next question. What is Gilbert's technique?
I think Gilbert technique, is that from Gilbert 10?
Mm-hmm.
He is the one who started with a tag with those electro probe, because for us, we normally go in underneath, under the chest, and then we probably tied it or we do it with a knife. But he created something with electrodes going to burn it. But that was really quick because like the stuff we had to do in 40 minutes, he can do it in 1 minute. Mm-hmm. So he will use those electro probe to go in under those layers and burn it right away. And they sort of use kind of stuff to blow it away. So it's actually minimum on the injury. And I thought that was impressive. Mm-hmm. I saw it about 3 years ago when they do it in animals. That was a whoa. That was really, really good. They use electroprobe. That's where the maze technique is using right now as well. They use electroprobe as well.
Yeah. Okay, can we go through the first and second questions quickly because the technology fell down?
Excuse me?
Yeah, can we repeat questions number 1 and 2 very quickly because the technology fell down?
I don't remember what's the first. I'm really sorry. What's the first question?
It's okay. Question number 1, what is cardiac surgery?
Oh, the cardiac surgery is the procedure that we use when your heart disease cannot be controlled with medicine or your lifestyle change, and including those open hearts or very small operation, like you will see the sort of pacemakers and also the loop. So the loop we can put in for like 15 minutes and take it out in a couple of days to monitor it. So those are the ones, because for the heart disease, we always want to use the lifestyle change to make it better, or for the medicine. But also, of course, there are some emergency procedure like heart failure that was hidden. Then we have to do it right away.
Mm-hmm. Okay. The last question: what is the job of the great vessels?
Oh, the great vessels. That's the 5 great vessels that we are normally have, and then you have 5, right? Then you have superior vena cava comes in, bring the blood into the right ventricle, and you have inferior vena cava bring the lower body blood into the right atrium, and then you pump the blood into the right ventricle, and then from the blood to the right ventricle, you go into the pulmonary artery and go into the lung, and then when you have oxygenated blood, you are ready for the body to use. You coming back from the pulmonary vein, coming back into the left atrium, and then you go into the left ventricle, and then you pump out to the body with aorta. Those are 5. The vena cava, the pulmonary vein and pulmonary artery, and also the aorta are those five great vessels. They pump in and out the blood from the hearts.
Okay. The last question. You as a human, what did you learn from surgery?
From surgery, that's a repairing procedure. If you are care enough, you always have a chance, like you are fixing a car. But unfortunately, I'm trying to fix a human. There are too many variables. I cannot just say try and error. So I learned it from it is I have to make my decision quick and also hopefully right away. And I have to be calm. If I'm not calm, then nothing will happen. That's how I feel. Yeah.
Okay. Yeah. Okay. It has been great talking to you. Thank you so much.
Thank you. I hope this helped.
Perfect.